Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, Brazilian butt lift, reversals and reductions. Can it be done? How does it work? I'm going to tell you. And then a new study out showing that the rate of complication from medical tourism may not be as high as we thought. Is it accurate? I don't think so, and I'm going to tell you why. And then finally, Ozempic and its effects on Botox, fillers, and fat grafting. It's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please crush that like and subscribe button and turn on those notifications. I'm your host, plastic surgeon Dr. Bruce Hermann. And with me is not Sarah today. My daughter Danica is standing in. This is her, third?
Yeah, I think so.
Fourth episode, yeah. Well, welcome to the show. Thanks for standing in for Sarah. Sarah's out of town this weekend, so I brought in Danica to help out. In the box, we got Brenda. How are you, Brenda?
Good. How are y'all?
I'm good. Fresh back from Austin 70 Limits, right?
Yes, it was great.
Was it awesome? Was that your first
awesome.
ACL? No.
Second.
Second.
Yes.
Yeah.
Will not be my last, I don't think.
Yeah, it's super fun. Yeah, I love concerts and especially festivals.
Yeah,
Who the best?
Oh, Sabrina. It
Sabrina
was
Carpenter,
so crowded. I think they sold more tickets than they anticipated they would because it was sold out, but it was crazy. It was awesome.
Were you able to get close to the stage, or was it just like
kind
pandemonium?
of. We were closer to the speakers, not quite. Yeah, so I felt like I was still kind of my ears were ringing, but
yeah, I bet.
we weren't shoulder to shoulder, but we had a little blanket and chairs, so we were kind of
nice.
Getting people, but people were just walking right through our stuff. So
yeah, it's just crazy out there. Who else was really good?
The Killers. They were
the
really
Killers.
Good.
That's
yes,
right.
The Killers.
I love the Killers.
Luke
live.
Combs.
Yeah.
I saw Empire of the Sun.
Oh yeah, nice.
Role Model. I haven't really heard too much of him, but I think I will now.
Yeah. You digging it?
Those are my top ones.
Yeah.
I'm way too scared to go to festivals because the crowds, I just can't with the crowds.
Yeah, it's a lot. That's why I like to stay in the back. I don't think I could be one of those people who wait for the doors to open and they sprint to go to get to the front of the stage.
We've done that. My wife and I have done that.
Oh my gosh, I want to just to say that I haven't experienced it, but I don't know.
It's so fun to be at a concert right up on the stage. We've done that a few times. We took Danica to see the Killers. It was what?
That was when I was 10.
Wow. Yeah, it was probably 5 years ago, and we got tickets in the pit.
Oh my gosh.
And she got kind of freaked out in the pit because it was pretty crowded.
I remember crying.
Oh my gosh. I would do it for Taylor Swift.
We saw Taylor Swift, but that was forever ago.
I don't
think you probably remember.
6. I don't remember.
You don't remember it.
I've seen a lot of her concerts, but
yeah, but cool.
Not that close to her yet, at least yet.
Oh, Taylor Swift? Mm-hmm. Yeah, we saw her at AT&T Stadium.
Yes.
It was pretty fun. The acoustics were terrible, and honestly, I probably wouldn't go see Taylor Swift again because, everyone sings so loud, you can't even hear her really.
Oh yeah.
I
can see that.
I had a friend that just went to a Taylor Swift this last year, and he took his daughter, and he's like, "Man, you couldn't even hear her sing because everyone around you is screaming at the top of their lungs." It's
also, it depends where you're sitting too.
Yeah, probably.
If you're in the nosebleeds, I feel like it's not worth it.
Yeah.
In my opinion, I don't know.
But you can at least say that you saw her.
Right.
You'd be like, I've seen Taylor Swift live.
Yeah.
And
same room as her.
Yeah, I was in the same room with Taylor Swift.
Everyone at my school has been talking about her new album. They do not like it.
Oh no.
They don't like it?
Mm-mm.
Why don't they like it?
Because people just think that the lyrics are kind of corny.
She just phoned it in for this album.
Yeah,
she
I
writes
think
a lot
she's
of
just
her
having
stuff.
fun with it.
Yeah, maybe. I think the album before, because Sarah was talking about this last week, and I said I was going to listen to the album, and then I didn't. But Sarah was saying that the last album was very melancholy and sad or depressing.
Yeah.
And so this one's supposed to be more upbeat.
Definitely.
I'm not a Taylor Swift fan. Her music is not my style, so I don't know. I just don't like any of her albums. But this one was not my favorite.
Stuff. I appreciate that she plays an instrument and sings. There's not a ton of people that are superstars like her that do that.
Yeah.
So, I mean, I appreciate her music. I mean, I'm not a Swiftie or anything, but
Yeah. She has some Botox allegations, so maybe you can do that.
She does have Botox allegations?
I have no idea if it's accurate. She just looked a little swollen on one of her face. 35 actually, almost 36 this year.
She should be using Botox.
Yeah,
that would be very normal.
And it was in one of her interviews last week. It wasn't Jimmy Fallon, but it was a different one, and her face just looked a little swollen. She looked older than she usually does. So I don't know if it wasn't healed all the way, but I'll have to show you that. Send it over.
Yeah, send it over to me. I'll look into it. I mean, but she probably is using I bet she's doing Botox. She's probably doing like lasers. I mean, she's in the spotlight, so she's got to maximize her aesthetics. I mean, well, she should, just from a branding standpoint.
Yeah.
I mean, if people are doing it who are nobody, I'm sure Taylor Swift's probably doing it. So, all right, let's jump into some topics today. Sorry, Danica, I normally get topics that are more like up your alley when you're on, and I didn't know you were out of school today, and so that was kind of a last-minute addition. But okay, so this first segment comes from a recent influencer, which I'm going to ask you guys if you know who this person is. I bet Brenna might know. I doubt Danica knows. But she was open up about a recent surgery. So this is a segment about Brazilian butt lift reversal/reduction surgeries. That is the influencer. Of course, you probably can't tell from her butt. But this is about Anastasia or Stassi Karakanala. Do you know who that is?
I've never heard of that.
She's apparently BFS with Kylie Jenner.
I definitely have heard of her, but I don't really pay attention to her like that.
I hadn't heard of her, but I don't get into the influencers as much. I mean, there's so many out there. So anyway, she's 28-year-old friend, BFF, Kylie Jenner. She's got like 10 million Instagram followers. So she's like a legit influencer. And she had previously said that in the past she got pressured into having a Brazilian butt. You know Brazilian butt lift? You heard me talk about this, right?
Yeah.
Yeah.
How can you get pressured into doing that?
Yeah, that's what I was wondering too. And so on some podcasts, she just said that it was almost like this expectation of influencers to have a certain look. It's not like someone put a gun to her head and said, get this Brazilian butt lift, but just with her job as an influencer, she felt the obligation to get a Brazilian butt lift. And she's regretted the procedure, and so she wanted to see about if she could get it reversed or reduced. And she actually posted on Instagram this past week that she was recovering from her BBL reduction. But here's the crazy part. She said it was just her first surgery and she was going to have to go back for another follow-up surgery in a few weeks, which is kind of wild. That must be pretty rough if they're having to do for sure 2 surgeries. Oh, no. But I've talked about Brazilian butt lifts on the show a lot. I really don't like those surgeries. And it's not about the aesthetics, because I mean, the aesthetics I think is fine. Back when the Kardashian look was in, I thought at least the initial look from these was great, but the reason I don't like them is because they do carry a dramatically higher risk of death, which is not something we generally talk about as a risk for plastic surgery. But Brazilian butt lifts do carry a much higher risk of mortality or death due to the risk of fat embolism, which is, of course, the Brazilian butt lifts, you harvest fat and then you inject it into the butt. That's the lift. It's really more of a butt augmentation. And if that fat gets into your bloodstream, it's a critically severe problem.
How come they don't just use like implants like they do with like breast implants?
That's a great question. I like that. So the reason is that the actual implants like that you would use similar to breast implants don't work well in the buttocks because there's a high risk of malposition or the implants getting out of place because you sit on your butt all the time. Like you usually don't lay on your breast that much except maybe when you're sleeping, but you sit down literally all the time.
Yeah.
And because of that, the risk of issues with the implants is very, very high. I would never, ever do an implant. I mean, I wouldn't do a BBL either, but I definitely wouldn't do a butt implant surgery. It's just not worth the risk and, issues with healing or implants getting
I can't imagine the healing process. Like, can you even sit down for like a month?
No, they would have people avoid sitting as long as possible. Like
I've never thought of that. That's crazy.
Yeah, I mean,
how do you sleep? Because I toss and turn. I want to be able to.
Well, you may not toss and turn if your butt hurts really bad.
That's true.
you might avoid. You may have to stack pillows up on either side.
Right.
But yeah, actual real implants for buttocks are not really a thing anymore. I think they do them in some countries, but they're just so bad that even the bad plastic surgeons won't do them, which is
God.
that's a pretty bold statement. So anyway, yeah, the BBLs though, risk of fat embolism is there. A lot of the times when we talk about deaths on this show, when we're talking about plastic surgery, horror stories in the news, almost all of the deaths are related to BBLs. There's other risks on top of that. The fat can reabsorb, it can scar, it can get hard. And so, I get a lot of people calling my office about Brazilian butt lift. I'm just like, no, I'm not going to do it. Like, I'm just not going to take on that risk for myself or for my patients. And I think that, I think enough news stories about BBLs has kind of gotten out because they are kind of trending down. They started to pick up when they first came out, and they've totally plateaued. And I thought this year might be the first year they'd actually go down in number, but it was basically exactly the same. Mm-hmm. So we'll see what happens next year. So let's say you did have a BBL and you didn't die from it, which is good, but now you don't want it. Is it possible to be reversed or reduced? And the answer is yes, sort of. It can be reversed, but it can actually be a pretty complex thing. And so, why would somebody want to reverse a BBL? I mean, two real common reasons. One is the change in trends of what's the ideal body. I mean, for the longest time, the Kardashian body was in.
Now it's like ballerina, right?
Yeah, right, ballet body. Did you hear me say that?
No, I just knew it. I'm on TikTok all the time.
Oh, wow, okay. Very good. Yeah, the ballet body is the current trend right now. I'm very impressed that you knew that. So changes in trends, more slim look, more athletic look is in. But then also changes in body habitus. And so what that means is as we age, the tendency is for us to gain more fat, unless you really are working hard to prevent it, which I'm trying to do myself. But the general trend is as we age, your body fat percentage starts to increase. And if you have all this fat injected into your butt and you gain weight, I mean, your butt can get out of control. I mean, you can end up with a serious dump truck. And
oh no.
Yeah, that would be bad, right? And so, if that happens, somebody who, 10 years in the past or 5 years or whatever might have been okay with the size, suddenly it gets too big. So those are some of the reasons that people might want to reverse or reduce this. So how do you do that? Well, the obvious answer is liposuction. Basically that's how you suck the fat out to put it in the butt. So if you use liposuction, you can potentially get the fat back out. However, there's a catch. There's an issue when you inject fat into the buttocks with scarring. And even if it heals very well, which it doesn't always do, you can get really bad scarring, but even if it does heal well, your fat tissue back there is not going to be like normal fat. It's going to be harder, stiffer, and doing liposuction is going to really suck. I've done,
That sounds awful. How does it get
harder? For the patient or me?
For everyone.
Yes, I would agree for everyone. Yeah, I mean, I've done liposuction on people who've had previous surgeries. It happens from time to time. I mean, that somebody wants lipo on an area that's had an operation, whether it be previous liposuction or whatever, and it just sucks. It's hard to get a really smooth result. I mean, it is doable, but it can be, not fun, which can make it more traumatic for the patient, more recovery. Sometimes you can potentially make it easier if you use some of the power-assisted liposuctions like ultrasound, but still it would be pretty crappy. There's other issues too, just like whenever you reduce fat from Ozempic or weight loss or lipo or whatever, you're suddenly going to have an issue with loose skin, and that can be a real thing where you reduce your buttocks and the size isn't as big, but now you have a saggy granny bottom.
Oh no.
Yeah, that's rough, right? And it's you may have to have another procedure to fix that, which may be what Anastasia or Stassi was talking about when she said she's gonna have a second procedure. So, it can definitely be fixed as far as you can reduce it. It's not simple. You definitely want to find somebody that does a lot of vision work if you're going to attempt that. And you're also going to have to realize that it may not be your only surgery because it's going to be possible that even once the fat is reduced that you are unhappy with the appearance because of the sagging skin, which is something when I do liposuction on patients, I always talk about. I'm like, okay, if you want to lipo your tummy, fine. Be aware your skin might be loose and it may or may not snap back from the elasticity and you may have to have another procedure down the road.
So Oh wait, I just had a question in mind.
Did it escape you?
Oh, I found it.
Okay.
So, do you think it's like more dangerous than a BBL, or is it like the same, or is it like less?
That's a very good question. So no, the actual first procedure is far and away the most dangerous because the risk of death from Brazilian butt lift is if fat gets into the bloodstream, which the reason that happens is when you're injecting fat into the butt or wherever, you're using a needle that's attached to a syringe that's got the fat globules in it. So you're putting it in and you're pushing it. And so if that gets into a blood vessel at just the right angle or whatever, and you push a bunch of fat into the bloodstream, that's what's potentially deadly. But when you're pulling fat out, no. I mean, there are risks associated with just doing liposuction, but generally they're not death unless it's a very extreme circumstance. In fact, we've done a couple episodes where some plastic surgeon, or maybe not even a plastic surgeon, some non-surgeon was doing liposuction and like punctured the intestines or the liver.
God.
Yeah, it happens from time to time. I mean, it shouldn't happen to anyone who's good, but like there's a lot of people out there doing liposuction that really shouldn't be treating patients. But so to answer your question very specifically, no, it's not near as risky to remove the fat as it is to put it in. When you talk about being hard, it's more about just like, is it going to look right? Are you going to be able to get out as much as you want, or is it going to be a scarred up mess and you can't even get out as much as you want?
That's so scary to me.
Yeah, I mean, I think definitely when it comes to reversing a Brazilian butt lift, this is definitely an instance of prevention is way better than the cure. Meaning, just don't do it. I mean, these are just bad surgeries. I know they're still mildly popular, although they're kind of waning, but there's real risks associated with them, and reversing them is not simple. I mean, like if you go get breast implants, and it's like, and I do these surgeries all the time where somebody has breast implants they don't want anymore, and so we take them out and we reshape the breast. I mean, it's very straightforward. I mean, patients do great, but reversing a Brazilian butt lift, not quite that simple, and could end up with multiple surgeries, and so.
I think it's going to go down in 2026.
I bet it does. I mean, I
Yeah.
think there's two big reasons why Brazilian butt lifts should go down. And there's really not a ton of them done. For example, when you look at implant-based surgeries, I think it's something like 300,000 implant surgeries are done in the United States every year. Brazilian butt lift, I think, is like 6,000.
Really?
Yeah, so you're talking is that 2%? What's 2% of 300, Brenna? Is it 6,000? 6?
I'm not a math person.
I'm calling you in for the wrong thing. Pretty sure, yeah. So I think, let's see, 1% of 300,000 would be 3,000, so 6,000. So 2% as many Brazilian butt lifts as like breast implants. Why was I even talking about that? I derailed my own conversation here.
Because I was like, I think they're going to go down.
Oh,
Like,
right.
there's
Yes,
too
we were
many
talking about the
reasons.
numbers. Yeah, thank you. Thank you for bringing me full circle. Yes, I think you're right because one, there's more and more news stories about deaths from Brazilian butt lifts that come out. I mean, I see them literally all the time, and we talk about them all the time. And then two is the thing that you mentioned, that the body style that's most popular these days is more of a petite look. So.
Yeah. I mean, like all over my For You page, I've never seen I don't know if I've ever been on the BBL side of like TikTok or Instagram, but forever I've just seen ballerina bod. So I'm surprised that they're like number 1 or number 2.
Yeah, that's been a thing now for at least a solid year, the ballerina body. And of course, not everybody does that. But when you talk about like influencers and celebrities and stuff, they're the ones more prone to kind of go along with whatever the current trends are. So.
Yeah.
All right, Brent, let's recap this one. Today, we were talking about one of my least favorite surgeries of all time that I don't even do is a Brazilian butt lift, and can they be reversed or reduced? This comes from Kylie Jenner's BBF, Anastasia or Stassi Konakoloff, I hope I didn't butcher her name, who just had her BBL reduced and was talking about that on Instagram. So, I talk about BBLs all the time. I do not like these surgeries. They carry a significantly higher rate of death over every other plastic surgery. They have other risks and complications that come along with them. I don't do BBLs. It's not that they're complicated. I just do not want to assume that risk for me or my patients. But can they be reversed if you've had one? Yes, they can. But even that's not simple. Doing liposuction on an area where there's been fat injecting is not like doing liposuction on an area that's never been touched. It's much harder, there's going to be scarring, it can be much difficult to get a very nice smooth result. Also, there is the concern of what is the skin going to look like. Just like when breasts lose volume after pregnancy, if your butt loses volume from you liposuctioning it, you can get a saggy granny bottom, and nobody wants that. So you may have to have another surgery to fix that. So yes, a BBL can be reversed, it can be reduced, but this is definitely a case of an ounce of prevention is worth a pound of cure. So just don't get a BBL. Plus, they're not even in style anymore. It's ballerina body time. We're out with the Kardashians, so just don't do it. So if you thought this was informative, hit that like, subscribe button. So, all right, let's move on. Okie dokie. This one could be a little boring for you two ladies because this is a lot about research and data. But it's a really good one. This bugs me big time when I am looking either at the news or I'm looking for topics for the podcast or for when I write for the paper or whatever, and I see someone claiming research that is just not right. Like they're making a claim for a research paper, and when you actually look at the research, the data, like the claim is just wrong. And so this one is one of those scenarios. In addition to that, it's about something that I really, really hate, and it's making that thing look good. So I'm super unhappy with everything about this topic.
This episode is so pessimistic.
I know, right? Sometimes I get on my fire and brimstone soapbox. Okay, so this is a segment over a recent study on medical tourism and the complication rate allegedly being lower, but that data is actually wrong or deceiving. So, talk about medical tourism all the time. Danica, if you're not sure what that is, medical tourism is when somebody, perhaps in the United States, goes to the Caribbean to get plastic surgery because it's a lot cheaper. The cost of doing business down there is much cheaper than the United States. So you can get plastic surgery for like 30 cents on the dollar.
Really?
Yeah, totally cheap. But there's a lot of huge problems with medical tourism. First and foremost, you have no idea if the doctor and or the facility that you're going to are legit. Are they properly certified? Is it regulated? Really, you have no idea. It's hard to even know in the United States if people are properly certified. So that's one of my biggest complaints. The other one is that when you have plastic surgery and you have complications, it's generally not in the first few days. It's usually later. So what invariably happens, and I treat these patients literally all the time, this patient goes out of the country, they get surgery, first day or two they're doing okay, they go back home, and then they have complications, and then they don't have access to their surgeon, and suddenly they're scrambling to find someone to take care of them, and generally nobody will, so they end up in the emergency departments.
Oh my God.
Yeah.
I've seen like a lot of videos about like South Korea being really good in plastic surgery.
Yeah, well, South Korea is like legit. So I mean, there are issues with medical tourism just in general. Even if you're going from like first world country to first world country, most of the medical tourism that occurs happens from first to third world because people are going for the cheap prices. If you go at plastic surgery in South Korea, it ain't gonna be no cheaper than it is in the United States.
Okay, I was just wondering, like,
this is a
I
good
thought
question.
they were the best.
So other problems with medical tourism, poor doctor-patient relationship, which invariably increases the risk of problems. No recourse if malpractice happens. Like if you go have plastic surgery in Dominican Republic or Mexico and you get totally botched, you cannot sue your doctor. Like it's just not going to happen. And then probably the other, all of these are important, but one of the bigger important things is the notably higher complication rate. This has been proven time and time again in numerous research papers that have been out there that when you go and get surgery abroad, the complication rate's higher. So this new study, and I took a picture of the article, Brenna, throw that up. Yeah, Fox, I can't believe Fox is throwing this up there. Largest study to date shows plastic surgery and medical tourism can match or surpass U.S. safety benchmarks. So when I saw this, I was like, yeah, there's no way that this is right. So I'm gonna break down this study for you and tell you why this study is. Well, what the data shows is, I mean, the title is technically true, but the data is just all wrong, and I'll explain what that means. So first off, this study is out of Colombia. Now, Colombia is not the worst place to get plastic surgery. There are many, many places much worse to get plastic surgery than Colombia. So Colombia, although I would say is not on the level of the United States, just my opinion, it is pretty good. So, okay, maybe they would have, a complication rate that's hopefully close to being on par. But there are a lot of flaws and problems with the title or the claim that they're making when you look at the data. So the claims come from this one single place in Colombia. It's basically an advertisement for them, which does it. When a place is doing a study about themselves to make themselves look good, we call that bias. Like they have a bias to make the study have an outcome that's favorable. If you're doing research, it's better if it's an independent person doing it. So right off the bat, the fact they're doing this research on their own selves to get a good result for marketing purposes makes me very pessimistic about it being accurate. Sorry, my brain just totally went off the rails there for a minute. So they claim that the rate of medical tourism complications 6%, which is kind of on par with the United States. They did break that down into subcategories. In some subcategories, the complication rate was the same, and in a few it was actually lower than United States standards. So first off, claiming that medical tourism complication rate's low when it's data from one single clinic is false. You could say potentially that this one clinic might have a rate of complications similar to the United States, but you certainly cannot say that medical tourism in general does, because it's just one clinic. It has no kind of indication of medical tourism as a whole. So right off the bat, the whole title is misleading. Does that make sense?
It's just clickbait.
Yeah, right. It's clickbait. Very, very good. They did have 2,300 patients, which ended up having 7,100 procedures, so it is a good number. However, the worst absolute part of this study, as far as the conclusion that they drew, is that the complications they included only were complications that happened while the patient was there in Colombia.
Oh my God.
Right. That's actually a huge, huge problem and red flag with the conclusion, because as I said in the very beginning of this segment, the overwhelming majority of complications that happen in plastic surgery happen later. Like, you don't hang out in Colombia for 4 weeks after you have surgery. Most people have surgery, they stay for a couple of days, they go to their first checkup, and then they're gone. And then the complications happen. So when they say it's a 6% complication rate, they're probably ignoring 3 times as many complications that happened after these patients went home, because these patients were all medical tourism patients. They weren't patients from Colombia. They're patients that flew in. I think 90% were from the United States, 10% from Canada, 1% from various other places. So by only including the complications that they documented there while the patient was there, it's not counting an enormous number of complications that certainly occurred. Also, they talked about a 1% systemic short-term complication rate, which included things like deep venous thrombosis, pulmonary embolism, which is a deadly thing, pneumothorax, which potentially could be deadly, and atrial fibrillation. A 1% complication rate of those things is staggeringly high.
Really?
The number, I do 300 to 400 surgeries a year. If I had a 1% systemic complication rate, that would mean I'd have 3 to 4 patients in the hospital with potentially life-threatening problems every year.
What is the word they said, the long one? What does that mean?
Which one?
The first one, it was short-term something.
Systemic?
Yeah, what is that?
Systemic. So, okay, great question. So a systemic complication would be one where, say I do a breast augmentation and the breast implant gets an infection. That's a local complication. A systemic complication is a complication that's so bad it affects your whole body. So deep venous thrombosis, which are basically blood clots in your legs, pulmonary embolism, which is where those blood clots go to your lungs and it's a potentially life-threatening problem, pneumothorax, which is a collapsed lung, which I can't believe that they're even getting collapsed lungs from plastic surgery. That means that, if you're getting a collapsed lung from plastic surgery, you should hang up your scalpel, because that is not a complication you should be getting.
That's awful.
Right, so to claim that they're having 1% systemic complications is terrible, and that doesn't again include the ones that happened after people got home. So, basically this study is comparing their best case, very short-term data that's extremely limited without including all complications, to the US registry data, which is enormously comprehensive, and it goes over enormous periods of time. So you're comparing apples to oranges here, and it's not even a good comparison, because they're leaving out the worst apples and comparing it to every orange on earth. Ooh, that's good. I'm really proud of myself.
I just can't believe that like Fox is like allowing them to post things like this. Like it's just.
I mean, the news people just see it as, hey, this is different than like what everyone in the world thinks, right? That's why it attracts attention, because if you ask any doctor out there, whether it be plastic surgeon or otherwise, and you say, hey, is medical tourism a good idea? They're going to be like, no, it's a terrible idea. Like, people die from it literally all the time, or get, horrible complications, and there's just all of these issues from medical tourism. So we're out here saying, hey, this is a bad idea, don't do this, and then suddenly a research paper pops up that says, hey, actually the complication rate's lower than if you get surgery in the United States. Someone's going to see that and be like, hey, this is different. People will click this. It's clickbait. It's good clickbait, right? But unfortunately, the data is just completely wrong. So I'm going to follow this one because I only saw the one Fox News picks this up. I initially pulled this article from the actual research paper that popped up in just like a throwaway, news article when I searched for plastic surgery. But man, if this goes mainstream, I'm going to start calling my media people and I'll be like, actually.
Oh my God. Don't say that ever again.
Come on, that was good. So, all right, let me recap this one real quick, Brenna. So, today we were talking about this new study out, which I absolutely hate because it talks about a topic that I also hate, medical tourism, and puts it in a deceiving light. So if you heard me talk about medical tourism, I'm against it. There's numerous reasons why I don't like medical tourism. Most importantly, that there's a lot of research to show that the complication rate is higher for things like plastic surgery if it's done medical tourism wise. One of the bigger problems is that the complications happen after you've already come home the majority of the time, and then you don't have access to your doctor. It's a bad doctor-patient relationship. You have no ability to sue for malpractice if it occurs. So I generally hate medical tourism, and one of the things we tell people is, hey, it's risky to do it. Well, a new paper came out which said that actually that medical tourism complication rates might be on par with the United States or even better. And I saw this and I was like, there is no way that this research is correct. And so I looked into it and no, it's not. It came from a single place in Colombia, which granted, Colombia is not a bad place to get plastic surgery. I wouldn't do it, but it's definitely better than a lot of places. But it was one clinic. To say that their data is representative of all medical tourism is just totally false. So that's one problem. But the most important problem with this research is it didn't include the complications that happened after the patients left Colombia. And as I said 30 seconds ago, most of the complications that come from medical tourism happen after you've already got home. So their complication rate that's on par with the United States is missing the overwhelming majority of complications that actually occurred. Yet people pick up this story like, oh, suddenly medical tourism's safe, and then you got Fox News running it like the gospel. Bad move, Fox. I'm mad at you. So I don't like this article because it's very deceiving, it's very misleading. The same thing still applies. Medical tourism is a very, very bad idea. It's not worth your life to save a few bucks. If you thought this was helpful, hit that like and subscribe button, and you can see some more stuff later. Pretty good, right?
That was great.
Yeah, I was on a roll there. Brenna, good?
It was great.
Yeah, thanks. Yeah, it was great. All right, let's move on to our last segment. Sorry, Danica, I don't have any stuff that's
It's okay.
right up your alley. I do appreciate you coming. You have good questions.
Thank you.
Your questions are very good.
I'd rather be here than school right now.
Absolutely. I hope your teachers don't. What if some of your teachers watch the show and they're like, oh my God, there's Danica.
They would know I'm skipping, so.
Oh my gosh. Well, hopefully they won't see it.
They're skipping class too if they're watching.
Oh, so true. Good
Yeah.
job, Brenna.
Thank
Excellent.
you.
All right, very good.
I'm excited for this segment, so.
Are you ready for this
I
segment?
am.
I don't
Okay,
know
cool.
what it's
Well,
about.
jump in there, Brenna. You've been kind of quiet. Making Danica take the lead up here. I think she's getting nervous. All right, here we go. So this segment comes from a question I got on social media. This is a segment on Ozempic effect on things like Botox, fillers, and fat grafting. And we just talked about fat grafting last segment, so there's a little bit of a tie-in from the last one. So we've talked about Ozempic and GLP-1s a lot on the show. Danica, do you know what Ozempic is?
Obviously, I know what Ozempic is.
Oh, obviously. Okay, what do you think it is?
Ozempic it's like a medicine that you take and it makes you really skinny.
Okay, more or less correct, yeah. So Ozempic is a shot that you take which activates the receptors in the body that, one, make you feel full, So like, you know that feeling after you like eat,
Yeah, it's
you know,
like a eat repressant or a
10
hunger
donuts
repressant.
or whatever at the house, you're like, oh my God, I'm so full. So that's what Ozempic does, but it also slows down the emptying of your stomach, what actually does make you full. So when people take Ozempic, they just don't want to eat and therefore they lose weight. We've talked about these drugs on the show for years now. Somewhere around 40 to 50 million Americans are taking GLP-1s every year, which is a massively huge number. But I will say, after following the data on these medications, I still am very much for them. The advantages of your health for the weight loss dramatically outweigh the very low rate of risks, which most people who have side effects don't have them very long anyway. So I really do like these medications. Yes, it's probably taken away my liposuction business, but on the other hand, it's picking up my tummy tuck and breast lift business, so it all works out in the end. I do think the results from these medications are great, but losing weight has other side effects. One of the most important things that we talk about when people are losing weight is what's going to happen to your skin, because loose skin is something that most people don't find super attractive. And when you lose a bunch of weight, your skin does get stretched out. And we've talked about that in the past. And things like Ozempic face, where when you lose weight in your face, it makes you look older, and then people are getting facelifts or fillers and all that. But this is not a segment about those things. This is a segment specifically on how does Ozempic or GLP-1s affect Botox, fillers, and fat grafting.
Oh.
Yeah, exactly. So we're going to go through these one by one. I'm going to give you the 411. Do they still say that out in the schools?
No.
Never heard of it.
I don't know what that is.
You guys have never heard the 411.
No.
No.
Are you guys messing with me?
Uh-uh.
You know, it's funny because I understand now why you guys have probably not heard that. So you used to dial 411 on your phone to get information for phone numbers. So like if I didn't know Brenna's phone number back in the 1990s, I would call 411 and say, I need a phone number for Brenna Dial. Is it Dial? Deal?
Dial.
Damn it. Dial.
Like soap.
Like the soap. Okay. Anyway, I'd say I need Brenna's phone number, and they're like, sure, and then they would give you your phone number. So it was great if you were a stalker.
That's
you
kind of
Wait,
scary.
they
yeah,
could do
right,
that.
totally. I mean,
Is
it
did
was
it
the
get
Wild
banned?
West.
Like, is it not allowed anymore?
I mean, it was like the phone book. Have you guys heard of the phone book?
Yes.
I mean, yeah.
Okay. I didn't know. You guys don't know what 411 is. So anyway, now you would go and you would be like, okay, you want to know about something. It's like, give me the 411, right?
Wait.
You
so
can just look it up now, I think. There's like websites. You just put it
Well,
in
yeah,
the phone
totally.
number.
But like that's where like the saying came from. Like, I'm going to give you the 411. I'm going to give you the information.
Does that mean like in the
You guys
1990s?
should like totally bring it back. What?
Does that mean in like the 1990s I could call 411 and be like, give me Kurt Cobain's phone number, and I could.
That would
his
be
bestie?
unlisted. You'd have to unlist your phone number. You could literally get anyone's phone number because there were no cell numbers at the time, and so you could look anyone's phone number up unless they were famous, and they would unlist their numbers.
Oh, that's
Yeah.
cool.
I guess. I mean, yeah, it was awesome. If you like wanted to stalk like some girl that you met in a class, you just call 411. Okay, where was I? All right, Botox, fillers, and fat grafting in Ozempic. Back on track. Here we go. Botox. You know what Botox is, right? You inject Botox and your muscles stop working. It's really good for these wrinkles, and these wrinkles here. So I think Botox is a great product. Honestly, it's one of the lowest hanging fruits for staying looking young into your older age. Because if you use Botox before the wrinkles start, you'll never get them, and you can look freakishly young at an older age. Mom's a good example of that. She's been using Botox since her early 30s, and she has no wrinkles. And yeah, she's looking good. So does Ozempic affect Botox? And the answer is no. We did talk about Ozempic face, which is where your face looks more aged. And some people might think, oh, well, if it makes my face look more aged, does that mean the Botox isn't working? And the answer is no, because it's different. When you lose weight in your face, it makes your face fall, which is different than the wrinkles that you get from your muscles moving. And so it's a completely different thing. So if you are taking Ozempic and you're taking Botox, fear not, it will not affect that. So boom, there's the answer to that. So let's move on to fillers. You know what fillers are?
Yeah, that's like if I wanted like really good cheekbones or whatever, I could just
You
like
could.
get fillers,
Yeah.
and then I'd have a square head or something.
Yes, square head, yes. Like lips, cheeks are a big one. Did I say lips? Yeah,
Yeah.
lips, cheeks, jawline. Those are the most common places that people use fillers. So will taking Ozempic and losing weight affect fillers like Juvederm, Restylane, the hyaluronic acid fillers. So it has no direct effect, but has a sort of indirect effect, because when you're using fillers, and not necessarily for the lips, but for like the cheek, the face, those areas, it's plumping up that area, right? So when you start to lose weight and you start to lose fat, you will lose it in your face. And it may look like your filler is not working as well as it was. You know, people might say, hey, my filler's not working anymore, like my face is starting to get hollow. Well, actually the filler's working fine, it just doesn't have as much fat over it. So technically it does not, Ozempic or losing weight does not affect fillers really at all, but you may think it might because it has an indirect effect of the area above that.
Oh.
Okay, so Botox, no. Fillers, really no, but you might think it is even though it's not. But we move on to fat grafting. All right, girls, I'm going to ask you this because I know you guys know the answer. Does taking Ozempic or weight loss drugs affect fat grafting, fat that's been grafted into your body? Make you go first, Danica.
Me?
Yeah.
I'm gonna guess yes.
Brenna?
Yes.
Both correct. Excellent.
Nice.
Excellent job, both of you. Gold stars for both.
Yay.
Yep, so fat grafting, it makes sense, right? If you're grafting fat from one area of your body to the other, and you suddenly put a lot of fat into an area because you want a result, and then you lose a bunch of weight, the fat that you grafted is also going to get smaller. Makes total sense, right? It's not a trick question. So fat that's grafted is definitely susceptible to weight loss. So if you're taking Ozempic and you've had like a BBL, or maybe you had some fat grafting in your breast or your face, you are going to see those areas definitely go down. And if you have a lot of fat grafted in there, so there's a big collection of fat cells, then certainly you may see even a more exaggerated weight loss in that location versus other places. Now, this is not a harmful thing. You know, losing the fat there is not going to cause you any problems, but it certainly could affect how things look.
Ooh.
Right?
And
Yeah.
wouldn't that just be a waste of money too? Like if I got an expensive BBL,
Right. And then you like
Ozempic?
lost a bunch of weight and it all went away. Yeah, I mean it would. Yeah, for sure. But you know, the benefits of the weight loss, if you need to lose weight, is definitely going to overshadow that. Now, I will say there's a lot of people out there these days using Ozempic that probably don't need to lose a bunch of weight. You know, like people are still kind of crazy about getting as skinny as they can, and you'll meet these people that are 5'7", 120 pounds, and they're on Ozempic. It's like, what are you doing? Like, that's just crazy. So anyway, that's where the real benefits of Ozempic come in when you talk about the true benefits. It's not really about aesthetics, it's about how it affects your health in a good way. Because when you are overweight, it negatively affects your health in so many ways. So yeah, I mean, it probably would be silly, you're right, to go and do fat grafting on a BBL, which, by the way, I don't like BBLs. But to do a
Really?
BBL and then get on Ozempic, I mean, it's going to defeat the purpose and you've wasted your money.
Yeah.
So hopefully that clears that one up about Ozempic and Botox and fillers and fat grafting. So, all right, let me recap that one, Brenda, for all those people out there in the internet world. Today, we were talking about one of our favorite medications of the past few years, Ozempic or GLP-1 agonists. Boy, we talk about these so much on the show. They actually are really great medications. If you are overweight or obese, these things can change your life dramatically, and all of the research shows that they are extremely beneficial. We've talked about some of the unintended side effects, things like Ozempic face, where your face starts to fall from the weight loss, things like people needing body contouring, tummy tucks, and whatnot. But I did have somebody ask me specifically, does Ozempic affect things like Botox, fillers, or fat grafting? Great question. Let me break it down for you. Botox, it does not affect Botox. Botox is a neurotoxin which prevents the wrinkles here, here, and here. It will not have an effect on that. Fillers, hyaluronic acid, which you might put in your cheek, your lips, or your jawline. It really doesn't affect that either. It's not going to cause the fillers to dissolve. However, when you lose weight over these fillers, it will decrease the effects of them, and you may be like, hey, my fillers aren't working as well because I'm losing weight. Well, no, not really. It's just you're losing fat. Now, fat grafting, does Ozempic affect this? Yes, 100%. That fat can be lost just like any other fat. And if you've had fat grafting to your bottom, to your breast, to your face, or whatever, and you suddenly lose a lot of weight, that fat's going to start to go away. So it 100% will affect that. And it's just something to kind of keep in the back of your mind. It's not a harmful thing. It's not going to cause any specific problems, but it is something that you need to expect. And it can change the aesthetics and make it, maybe not look as good as you want. So that's the 411 on Ozempic, Botox, fillers, and fat grafting. If you thought that was helpful, please hit that like and subscribe button. So, cool.
Yeah.
All right, girls, do you have any final comments?
I like how it all kind of tied together.
Yeah, it was a pretty good episode, do you think?
I did
I'd say
too.
so.
I liked it.
Good. I'm glad you guys. So, Brittany, you said you were wanting to hear about that one. Why was that segment exciting for you? Was there something specific about it?
Yeah, just like I was curious about that, honestly. I've thought about that because
Okay.
Ozempic, I feel like I've just seen and heard a lot about it, and lots of I keep seeing this commercial. I think it's Serena Williams.
Oh, she's on Ozempic commercial now?
Yeah.
Is she
And
taking Ozempic?
That's what I'm wondering. Or I don't know if
She's
it's
in great shape.
I
or
think
she
it
was.
is Ozempic, but
Oh, maybe
yeah.
she's diabetic though. Ozempic. Ozempic initially started as those medications have been around for 2 decades, but they started out as diabetes medications. And interestingly enough, they discovered that when people were on them for diabetes, especially a little bit higher dose, they all started losing weight. And now this new market's opened up for these drugs to be used as weight loss drugs. That's happened before, what's the one? Viagra is another drug that started out as one thing, and then they found out it had another use, and then it became much more popular. Yeah, yeah. So, all right. Well, I think that's all the time we have today. Danica, thank you for standing in. You did great. You had some great questions. I think you're.
she did. I think we should
yeah.
keep her.
Yeah, her career as a podcaster is on the rise, I think. Jeff wants you to have your own show. Yeah, you should start one. Brenda could be your producer.
Yes.
Ooh,
Yes.
that's true.
All right, Brenda, thank you too, as always.
Absolutely.
Please leave us a comment. If you have any particular topics or things you'd like us to talk about on Nip Talk, we would love to do it. Just leave us a comment and we will do a segment on that. So see you next week. Bye.